We're focusing on heart health every Friday morning throughout the month of February. Here to help, here to help us out today, Dr. Scott Feitell, Director of Heart Failure at Sands-Constellation Heart Institute for Rochester Regional Health. Good morning to you.
Good morning. Thanks for having me.
Heart failure. That is a scary combination of two words.
Yep. Sure.
You hear that and you think that's not good. What is heart failure?
Yep. So heart failure is basically an umbrella term for a lot of different diseases, but basically it's the heart's inability to maintain blood flow to the whole body. So the heart is just not able to support the body the way it's supposed to. And it can be very dangerous and it can be very deadly, but there have been a lot of advances in the last few years that can really help our patients.
Okay.
Yeah.
So you get that, your doctor says, you know what, I'm seeing heart failure. It doesn't necessarily mean that you have very limited time.
No, hopefully not. It's the worst terminology in the world, and it's a very old term, but we still use it. And the reality is, though, that there's so many new advances with new medicines that we use and new technology that we've embraced that can really help patients live a nice, long, fruitful life.
Yeah. Helping people to understand what heart failure is there a symptom where that stands out that someone would think, I need to go in because I might have heart failure?
Sure. Lots of symptoms, but the one we worry about the most and what usually limits patients is shortness of breath. Okay. So when the heart's unable to pump enough, patients can get quite short of breath when they're trying to do daily activities.
And for strenuous activities or just longer periods of time, or could just be sitting here trying to catch your breath?
Unusual for it to be at rest, but not impossible. But a lot of times it's something simple like going grocery shopping and unable to get the cart up and down the aisles, or unable to do laundry around the house. Okay. Simple tasks like that can be very difficult.
So what do you do to make those symptoms go away?
Sure. So obviously some diagnostic tests to make sure that's really what it is, because lots of things can cause shortness of breath, and it may not be something as dramatic as heart failure. It could be asthma or COPD or other diseases. But if it is heart failure after doing a battery of tests, there's a lot of good medicines out there with 2 newer drugs on the market that have been proven quite effective in helping people live longer, keep them out of the hospital, and again, be productive members of their family and of society.
Speaking of family, you know, if you have a relative, you know, who this has happened to them, is this something that you need to be more concerned about, or is this based on lifestyle? How do we get to this diagnosis?
Sure. It's multifactorial, so there's definitely a familial component, so we always blame our parents for our genes, and unfortunately sometimes there is a clear-cut genetic predisposition to the disease. But again, sometimes it's lifestyle, and so I always spend a good portion of my visit with each patient reviewing some of the bad habits they may have picked up or some things that they didn't realize were bad habits. The obvious ones are smoking, leads to coronary artery disease, which can lead to heart failure, but also things like you know, diabetes that's not well controlled, kidney disease. There are a lot of other factors that play a role in that we can help patients with to get things under control and prevent heart failure.
Is this
kidney disease? I just want to follow up on that. That surprised me.
Yeah, so the kidneys and the heart are very intertwined and work. They control the body's volume status. So when the kidneys get unhappy and unhealthy, the heart can get unhappy and unhealthy right along with it.
Yeah.
And so it's very common for people with kidney disease to also have heart disease.
Yeah, all organs working together. Is this something, I know you said there's been advances made and there are drugs that can be taken for something like this. Is this something you live with for the rest of your life and you maintain? Or is it something that eventually will subside?
Very good question. So for the most part, I usually tell my patients from the get-go that even if I get them better and even if I get the heart to recover, that they are going to be on lifelong medicines. So whatever went wrong in their body that led to the heart failure exacerbation, and even if we get the heart to recover, we think that those signaling pathways still remain in the body. And so I usually encourage patients to stay on medicines lifelong. We may tweak things here or there or adjust doses, but for the most part, I usually commit them to lifelong medicine to ensure their heart stays in tip-top shape.
Do you find that men or women are more at risk of heart failure?
Oh, excellent question. So probably both equally, but different types of heart failure. So problems with the heart actually squeezing and pumping tends to lend itself more towards men. Problems with the heart actually relaxing and being able to allow blood into it usually predisposes towards women, and we don't understand why that is.
Huh. I'm sure there'll be more studies done as you guys continue to watch this. You've made advances over the years and more to come. Where could people go if they're thinking that maybe they might have some of this going on or someone in their family? Obviously, keep the discussion going for people in their family, but where can they go to find out more information or just, you know,
Sure.
get checked out?
The American Heart Association has great resources on their website. You know, you always have to take Google with a grain of salt because a lot of stuff gets put on the internet. So, but sources like WebMD and Google can be very helpful at top points, as well as the American Heart Association. And when in doubt, always go to, you know, call their primary care doctor, start there, and just get a quick checkup. And it can, a few simple tests can really send you down a path if we're concerned that there's heart failure. And ultimately, someone like me can certainly help out.
Yeah, Director of Heart Failure at Sands-Constellation Heart Institute. Neat that we have that in our community.
Yeah. Yeah. Anything?
Nice to meet you.
Yeah, I was going to say, anything you want people to take away as they recognize Heart Health Month?
Most importantly is, you know, risk factor modification. So healthier lifestyles, working on diet, working on the ability to lose weight, quitting smoking is very helpful. And then more importantly than that is don't ignore symptoms. So if you don't feel right, if shortness of breath is something that you haven't been living with and all of a sudden presents itself, go see your primary care doctor so that they can work you up and make sure that it's not heart failure or something serious.
Yeah, all right. Time to love yourself and take care of yourself this month and know about what's going on with your body. Thank you so much.
Thanks for having me.